Good afternoon, everybody. Thank you to Senator Boscola for convening today's extremely important hearing, and also to my co-chair, Senator Muth, whose commitment to public service and to righting wrongs is who brought the situation that specifically exists at the Southeast Veterans Center to my attention. We are going to be talking today about nursing home care across the state. And finally, thank you to all the members on the panels who have direct firsthand experience and knowledge of what our nursing homes and our veteran homes are going through right now for your appearance today and for your testimony. We convened the hearing for the purpose of better understanding the impact of this novel virus on Pennsylvania's nursing homes and state veterans homes. And we know the residents of these residential facilities are the most vulnerable to contracting and perishing from COVID-19. Unfortunately, the data and the statistics just bear that out. A few numbers. 27% of COVID positive cases in Pennsylvania are in the age demographic of 65 or older. 87% of the COVID deaths are in this demographic. Pennsylvania's deaths due to COVID-19 as of yesterday has now exceeded 3,000. And 2/3, 67.3% of them have been residents at nursing homes or personal care facilities. Okay, so those are the numbers. So if you're a senior and you get COVID, you're more vulnerable. Additionally, if you are a senior and you live in a long-term facility, you are at that much more greater risk. The nature of these facilities operations just make them prone to rapid spread of what is a highly contagious virus once it enters via a resident or a staff member. Therefore, we must be mandating the best practices we know to protect this population. It is literally a matter of life and death. We must understand with full transparency what is happening in these facilities in order to protect the lives of our most vulnerable. I am most appreciative. I'm looking forward to this candid conversation that we're about to have, and I thank everybody for coming here today.
Thank you, Senator Iovino. Our first panelist is Dr. Valerie Arkoosh, the chair of Montgomery County Commissioners. Dr. Arkoosh.
Great. Good afternoon, everybody. Thank you, Senator Boscola, Iovino, and Muth for inviting me to join with all of you today. I really appreciate the opportunity to address this very challenging situation, which we are no different than any other county here in Montgomery County, and we are certainly experiencing this challenge. So just a little bit of background about Montgomery County. We have approximately 75 Pennsylvania Department of Health licensed and regulated long-term care facilities in Montgomery County. And we also have a number of other congregate care type facilities. These are typically smaller facilities that are often associated with homes for drug and alcohol treatment, or for individuals with intellectual or physical disabilities, or smaller type congregate settings. In total, we have about 620 of those facilities in our county. So I think per capita, we actually have a pretty high concentration of these types of facilities. So this was something that wasn't initially on our radar here in the county. We got our first 2 cases of COVID-19. It'll be 9 weeks on Saturday, 9 weeks ago on Saturday. It was March the 7th. And we were under the assumption that these facilities would be assisted by PADOH, which is their licensing authority and regulatory authority. And many of them are also members of the Hospital and Health System Association of Pennsylvania, commonly known as HAP. So these institutions were not first and foremost on our to-do list. We had a lot going on in the early days of this pandemic, and we knew very clearly what was directly under our purview for our county and our county Office of Public Health, and we did not think that these facilities were on that list. However, as time went by, it became apparent to us that there were some really serious problems in our long-term care facilities. And those problems became apparent to us in two ways. One, we started to see an awful lot of calls to 911, to our EMS system, for patients that needed to be transported to hospitals. And we started being alerted by some of our EMS groups as well as some of our hospitals that they were getting an awful lot of patients from long-term care facilities. We also started to see PPE requests coming in, requests for personal protective equipment coming into the county, whereas we had been under the assumption that HAP would be supporting them in those PPE needs. And then, of course, sadly, we started to see numbers of positive cases as well as number of deaths rising from those institutions. As of yesterday, here in Montgomery County, we've had 286 deaths of confirmed positive COVID-19 from individuals who were at long-term care facilities. That is out of a total of 353 deaths here in Montgomery County, which is 81% of our deaths here in Montgomery County. Now, I want to point out, which I think is probably obvious to most of you, but long-term care facilities are extremely challenging situations when it comes to communicable diseases. The staff there are caring for some of our most vulnerable members of our community. They often live 2 to a room. By definition, they often have underlying medical conditions. That may be why they're there. I also want to remind people that not everybody that's in one of these facilities is there on a permanent basis. Sometimes people are there recovering from a stroke or a heart attack or major surgery. So there's a wide variety of people that are in these facilities. They often are 2 to a room, and the care that the staff must provide is often quite close contact or intimate, feeding, bathing, dressing, and other tasks. So it's a very, very complicated situation when it comes to preventing a communicable disease. So we first began by calling these facilities, and we got a number of staff from both our senior services staff and Office of Public Health that put into place a system where we were calling about a little over 600 congregate care facilities, not every day, but just trying to call and check in and find out what was going on. And as we started to make those phone calls, we learned from the self-report of these institutions, many of them had a number of residents that had tested positive, many had a number of staff that had tested positive. So we conveyed our concerns to the Pennsylvania Department of Health in a couple of phone calls, and DOH responded. I'm sure you've heard they engaged a group called ECRI to help with some of the outreach to these facilities. We, again, mistakenly assumed that there would be some on-site assistance to some of these most highly impacted facilities. And we actually gave DOH kind of our top dozen of facilities that we were concerned about. However, it did become clear that there was no capacity to make on-site visits to these locations. So as a county, we decided that it was the right thing to do to try to take this on ourselves. So our staff have now formed 6 teams. We call them FAST teams. They are field assessment and support teams. Each team is made up of 2 people, a public health nurse, often together with someone from senior services or another individual from our Office of Public Health. And they are literally going out and visiting these facilities. What started out as like a 2-page checklist every day has been modified. Now I think we're up to about a 10-page checklist because they're learning as they're going. I mean, we're literally building this as we're doing it. As of the end of the day yesterday, they had visited 48 facilities in the last about 12 days. So they have been working very hard and very fast. And we've learned quite a bit from those visits. And I just want to share some of what we have learned with you, because perhaps it will give you some thoughts as we go forward, and particularly as we try to plan for the next time and hopefully help these facilities do better. First of all, I want to be very clear that these facilities are pretty devastated. I think just about every place that our staff has visited is finding staff that are just heartbroken at the fact that the virus got into their facility. Many of them thought they were doing everything right, that they had closed down early. Many of these facilities had actually welcomed HAP together with a member of our health department out for a visit in early February to talk about personal protective equipment and things like that as COVID was starting to come into this country. So that many of them had thought they'd done everything right. And so they're pretty devastated at how impacted they have been. And they're very saddened at the loss, I think, as Senator Muth mentioned, of people they've cared for in many cases for years. My team has found that in general, infection control is adequate, but they're not really prepared for the situation that they find themselves in now. None of these facilities were particularly prepared for a long-term outbreak, an outbreak that is lasting for weeks and is going to continue to last with no end in sight. These facilities were very slow to get personal protective equipment. They very much felt like they were second to our acute care hospitals. And so that was both frustrating for them and also pointed out that none of them had appropriate stockpiles of personal protective equipment to manage on their own for really any period of time. Like every other facility in the United States, they remain very short on gowns. And one of the things that our staff has found is that they were not well trained on how to follow the guidelines for reusing personal protective equipment during a pandemic. So the hospitals are all following those guidelines. And so our staff's provided a lot of training on how to do that effectively and as safely as possible. They have noted that the long-term care facilities that are connected to an acute care facility, i.e. a hospital, tend to be doing better in some of these measures. Most of these facilities did not have strong occupational health knowledge about fit testing for N95 masks. And for those of you who may not be familiar with that, whenever you get an N95 mask, which are the good masks, it has to be fit tested to you individually to make sure that it doesn't leak. And there's a well-established process for that. A number of these facilities just weren't familiar with that process. So again, just a lack of knowledge. They would have done it in a heartbeat, and as soon as they learned about it, they've started to do it. But these are just examples of things that were just, not part of their baseline training. One of the things that we've recommended to every facility that we've gone into is that they test every resident and every staff member. And we have reiterated over and over how important it is to test everybody. What my staff is finding is that they're willing to test their residents, and we're trying to help them understand how they would go about that and get connected to testing. They have been concerned about testing all of their staff. And the concerns largely come down to, what if we don't have enough staff to run our facility? So PADOH has been helpful to us in now creating a mechanism where we can reach out to them if there is an unmet staffing need at any of our facilities. They have been working with the National Guard and have come in or offered help to a couple of facilities in our county already. So we're trying to just make sure that these facilities know about those resources, because if they don't test the staff, then it will be unlikely that they will necessarily get a handle on this. One of the things that we've learned about this virus in the 3 months that we've known about this virus is that it's very clear now that there are many people who are asymptomatic, who are contagious, and they are going to work not knowing that they might be contagious, or in some cases, and I think also Senator Muth or maybe Senator Iovino mentioned that many individuals that work in these facilities really need these paychecks. They are not big paychecks, and perhaps unwittingly maybe had a few very mild symptoms and came to work anyway. So in the absence of testing everybody in a facility, there's really no way to know what you're dealing with. Many of you may have followed the testing that we did in our Montgomery County Correctional Facility. We tested every inmate and every staff person. And we found out of 942 inmates that 171 inmates tested positive who had no symptoms. We also found 5 people in the medical staff who had no symptoms that tested positive. And we found of the regular staff, about 28 people that tested positive, that I think 23 of which had no symptoms. So it's extremely important that if you're trying to get a handle on an outbreak of a communicable disease, that everybody be tested. So that would certainly be one of our recommendations going forward. So again, I think I'll stop there, but I just want to reinforce that these folks are working so hard. They are really trying to do their best with the tools that they have at their disposal. I think that we can do a lot better, and we've learned a lot from this at our county. And I can obviously share more details with any of you that are interested about just the baseline training that these facilities have, the amount of stores of equipment that they're given, that they have at their disposal, that the occupational health training that they're given, and then, a lot about how they staff. So for instance, many of these facilities are owned by one corporation, and that corporation might have 3 or 4 or 6 sites in a region. And there could be occupational therapists, physical therapists, speech therapists that travel from facility to facility. And so again, the need to test everyone in a situation where there's a communicable disease is so important, because again, unwittingly, one individual could carry disease from place to place to place. So I'll stop there and happy to answer any questions.
Thank you, Doctor. I